All right. Well, welcome to our new Pick the Brain podcast here at Instinct. I'm Dr. Caleb Frankel. I'm an ER vet by trade and founder of Instinct. And we're starting this new project because over the years of building Instinct, we've been really fortunate to get to learn from some of the best in the field on things like hospital operations and leadership and ownership, industry trends, and of course, technology. And so that brings us to today, where I'm really excited to welcome Dr. Corynn Cackler. For those who don't know, Corynn is the founder of STATVet Animal Urgent Care in Tulsa, Oklahoma, which now has 2 locations. Congratulations.
Thank you.
STATVet is a bit of a pioneer in my mind and our team's mind on how, this sort of semi-new idea of the urgent care model in veterinary medicine can work really well. And so welcome, Corynn. Thanks for spending a couple minutes with us.
Thank you for so much for having me. This is very exciting.
Awesome. Well, okay, I wanted to have you on today to pick your brain on some of the success you've found in the urgent care model in your community. So I've got 2 questions for you this morning. My first one is actually about your client satisfaction. You're kind of known on the Instinct team as having some of the most incredible ratings. If you don't believe me, the audience should check out StatVet's reviews online. And most of the time when you read through them, the only complaint is you limit the stars to 5 they can give you, which I think is an amazing review. But why I'm asking you about that is I'm an ER vet. I've lived this urgent care, ER kind of model. They're a little different, but they both have a challenge, which is you don't have the trust of the client coming in. They have to be there. They haven't chosen in a lot of instances. And it's really hard to actually get good ratings and reviews. You can practice good medicine, but we all know that's a really challenging thing, both in human health and veterinary medicine. And so I'd love to hear, how you think about this client satisfaction that you've been able to deliver for your community and how you prioritize that with staff building and anything you want to share.
Right. Yeah. So first of all, that's very kind. And I'm glad that you noticed we work really hard to make clients happy. And honestly, the number one way that we get good positive reviews is we ask for them. And we pretty proactively, if we have clients who have a good experience, we reach out and send them a link and say, hey, we would love if you would leave some feedback. It helps other people find us when they need us, just like you did. So I think that's the number one thing that we do. But other things that we do, first of all, I work really hard on creating a team who is happy and wants to be there and wants to take care of clients. And morale is extremely important to us in my practices. And so we've created an environment where people are happy to come to work and happy with the people that they work with. And clients just feel that when they come in. Other things we do is we work really hard on transparency. So if you've worked in any of the ERs that I've worked in, the ICU and the ER service are kind of way in the back of the hospital in a cave, and the clients can't see anything that's going on, and they don't know what's happening to their pet. I wish I could show this on the podcast. Of course I can't, but both of my hospitals are designed with the treatment area fully visible from the lobby. Wow. So we have a big, huge window behind the reception desk, like 12-foot window, huge window, that clients can just see directly into the treatment area. And so they can see what's going on with their animal, and they can see how their pet is being treated, and they can see who's taking care of their critter. And so I think that helps a lot. And then the other thing is a lot of ERs get complaints about cost of care. And we always prepare very detailed estimates for clients before we do anything, go over it with them in detail, let them choose the things that they do or don't want to do. And then we work our very, very best to stay within that and honor the agreement that we have with the client. And so I think those are some of the key things that we do that make our clients happier. I've been really pleased. I came out of ER environments where clients were not happy and yelling and leaving negative reviews. And I have been very pleased to have a different experience with our clients at StatVet.
That's amazing. And I can imagine when you do things like the transparency that you talked about in the window, you kind of self-select for staff who are, embracing
Yes,
that principles because I
absolutely.
imagine some don't want to work at a place where that's happening, and maybe they're the wrong
Right.
kind of person, right?
Absolutely, probably so. And anytime we bring new people in for interviews and things, that they comment on that a lot,
Mm,
and that gives us an opportunity to have a discussion of like, yeah, we do let clients see everything that's going on. We do let clients come back and watch an ultrasound if that's something that they want to do,
cool.
and so it is important that you're okay working in that kind of environment, and that you find value in that.
Yeah, it's great, and it's so simple. I mean, it's not a huge change to the workflow.
No, right.
It's really just a window and the
Hmm.
culture.
Yeah,
Okay, I love
absolutely.
that. All right, my second question is about the urgent care model itself. So you started StatVet coming off the pandemic, I believe.
Hmm.
Um, I think it was 2021, and there was obviously around that time this giant challenge we were all seeing and talking about, which was caseloads had
Hmm.
spiked. Wait times at every veterinary hospital were hours and weeks, right? Um,
Yes.
and I think it drove a lot of this. Maybe we need a middle ground between general practice and the large emergency specialty in this urgent care ownership. But my question is, some of that has changed a little bit. And I'm interested in going back. Like, is that why you opened urgent care? How you think about this model? And maybe the other thing is, how do you educate the referring veterinarian community about where you fit into this model? How do you coach on triaging? This can stay with you, this could come to us, this really should go to a larger specialty. So would love to hear any tips or thoughts on that.
Yeah, the first thing I would say is that is an ongoing, ever present thing that we have to do. I just got a call from a primary care veterinarian yesterday who said, "Hey, I've got this kiddo got hit by a car. It's got a diaphragmatic hernia. Can I send it to you?" And I said, "Absolutely not." That patient needs to be somewhere where it can have an anesthetic ventilator, where it can have post-operative oxygen care, where it's got an overnight fentanyl CRI. Like, those are not things that we offer at our facility. I love that you called me, but this case needs to go to a 24-hour practice. So
Yep.
that is definitely something that we continually educate people on. And another thing we educate our primary care vets on is what we can do. Because in my practices, we do complete abdominal ultrasounds. So we get referrals for patients who need that kind of care. We do abdominal surgeries. And so we'll cut foreign bodies and PIOs and things. And so communicating with them that, hey, we can take that case. It doesn't necessarily have to go to a 24-hour practice if it's pretty stable. So I think that's an ongoing challenge for us.
Yep.
Um, I did start these practices coming off the pandemic, just like you said. We opened in early 2022 for the first practice, and Tulsa is a metro area of about 1 million people. Our next closest city is Oklahoma City, is about an hour and a half away. And so when I opened StatVet, there was only one 24-hour practice
Mm,
in the entire region. And I worked at that practice, and it was incredibly busy and constantly overwhelmed.
mm,
And I just hated that pets who had a really painful ear infection, or pets who had a torn toenail or a small laceration, like things that needed to get fixed, were having to wait 6 and 8 hours to get that care. And so I think urgent care really did fill that need for clients, for primary care veterinarians, but also for the ER, so that they didn't have to, tell those clients that they couldn't help them or that they would have a terribly long wait. It allowed them to focus on the animals like a diaphragmatic hernia
yep.
that really did need that level of care. And then we were basically the pop off valve, to take all the critters that, weren't critically sick but still needed to see a veterinarian. Um, Moving out of the pandemic, we are seeing caseload kind of change. We're seeing the economic environment kind of change. I still see clients who have a need for an urgent care scenario. We still see primary care veterinarians who can't get pets in within a couple of days because they're booked on their surgery schedule or whatever. We see lots of clients who don't have primary care veterinarians at all.
Mhm.
And then we see lots of clients who like our hours because we're open until 11 o'clock in the evening,
Yep.
or we're open on weekends, and that fits better for them. So we still talk to those clients about, like, you still need a primary care veterinarian. You need somebody who's going to vaccinate your pet and take care of their teeth and do all of these sort of wellness things that we don't provide. Um, but it definitely it has evolved a little bit, but it continues to, I think, fill a very important niche.
Okay, that's really helpful. So if somebody is listening and they're a budding practice leader and they're thinking of starting an urgent care in their community, do you have any tips or tricks you would give them, lessons learned on?
Oh, so many things.
Yeah,
I think the hours that you choose to be open are extremely important. I think being open until 10 or 11 o'clock at night is when you will see the majority of your cases.
yeah,
Um, my second practice that has only been open for about a year, it's open 4 p.m. to 11 p.m. on weeknights. So we're literally taking advantage of, when primary care vets close and then open into the evening to take care of those pets. The other thing that I would say is decide what you are and aren't going to do. I have seen some urgent care practices open that try to not do any sort of anesthetic procedures. So they don't unblock cats. They don't do any sort of abdominal surgeries. They don't do any kind of ultrasound imaging. And unfortunately, I think those practices really limit the kinds of pets they can take care of.
yeah.
And that creates business challenges for them. And so I think a lot of folks had this idea originally that urgent cares wouldn't do that kind of stuff. But I've actually been really pleased to see the number of cases that we really can manage well on an outpatient basis who don't necessarily have to be admitted. And so choosing what your urgent care is and isn't going to do, are you going to put in an OR? Are you going to focus on imaging and things like that? It's important to kind of delineate that stuff so you know who you are.
I love it. Yeah. Okay, great. Well, thank you again for being here. I know if I lived in your community, I would bring my pets to your hospital. You guys do some
Oh,
amazing
thank you.
work. So
Thank you.
I'm going to wrap up with two quick questions. So first, what's one leadership lesson you learned maybe the hard way? I like to call this 2x4 advice. That's something mentor taught me. There's always 2x4s for leaders sticking out from corners, and maybe you
Right.
can help some fellow colleagues duck a few times. So what would you give as a leadership lesson you learned?
Yeah. So what immediately pops into my mind is to be picky with who you hire. And that applies for both veterinarians and for your support team. A bad hire who doesn't fit in to your culture and doesn't offer the kind of client care that is important to you can do a lot of damage to a practice. And I would rather be short staffed than bring somebody in who doesn't fit. And so, we kind of got into this habit after the pandemic with a sort of an any warm body kind of mentality.
Yeah.
And for my practice, I have found it to much more successful if we are patient and we really wait for the right candidate to show up. Being picky is important.
Yeah, sage advice. That resonates. Okay, the last one is, what is one underrated tool or feature of your hospital that you do that your team would probably riot if you took it away? And I'll say besides Instinct, of course.
Yes, we do love Instinct. We do love the Instinct client chat. That is super, super helpful.
Amazing.
But I think we could not function and everybody would immediately start crying if we took away our ultrasound machines.
Yeah.
We have ultrasound at both practices. We use them like crazy. Everybody is trained on POCUS imaging and things like that. And we love our ultrasound machines.
Yeah, it's become a really powerful part of our
Mm-hmm.
corner of veterinary medicine. So totally get it. Well, thank you again for coming on. Keep doing awesome work, and we'll talk soon.
Thank you for having me.